Hey, ever felt overwhelmed by all the talk about mental health? So many disorders, so many names, what does it all mean? You're not alone. Mental health often feels like a maze of confusing info, but it really doesn't have to be. So grab a comfy seat and let's get into what's really going on inside minds and how people find their way back to feeling better. Borderline personality disorder, BPD. Picture your emotions as a wild roller coaster that never stops. Huge highs, deep lows, and sudden drops. That's what life can feel like with BPD. One huge challenge is this terrifying fear of abandonment. Like even the smallest change or a perceived slight can trigger wild panic and desperate attempts to keep people from leaving you. This fear makes relationships feel like a constant tug of war, flipping between idealizing someone and then suddenly seeing them as all bad. Psychologists call this splitting. Plus, recurring thoughts about self-harm, suicide, relentless anger, and feelings of emptiness aren't just mood swings, they're serious, painful symptoms. Most people with BPD have a history of tough childhood experiences, trauma, abuse, neglect, so it's hardly just moodiness. Eating disorders. When food and body become the battleground. Eating disorders go way beyond just being concerned about your body. They're mental battles that twist how you see yourself and your relationship with food. Here's the lowdown on the most common ones. Anorexia nervosa involves severe food restriction, leading to dangerously low weight and serious health risks. Bulimia nervosa traps you in cycles. Binge eating followed by purging through vomiting or other methods. Binge eating disorder means eating large amounts frequently but without purging, often paired with guilt and shame. And there are other forms too, like avoidant restrictive food intake disorder, ARFID, where eating gets restricted often due to sensory issues, not body image. Narcissistic personality disorder, NPD. Meet someone who always needs to be the center of attention, who craves admiration like it's air. That's NPD. It's more than being vain. They actually struggle with fragile self-esteem hiding behind the confident mask. Criticism feels like a heavy blow, sometimes sparking rage or withdrawal. Relationships can feel very one-sided, like it's all about their needs, with little true empathy. If you relate or know someone like this, therapy aims to build real empathy, stronger self-confidence, and better ways of connecting. Antisocial personality disorder, ASPD. Ever met someone with zero regard for rules or other people's feelings? Maybe they manipulate, lie, or take risks with no remorse? That's ASPD. It's not just about crime, it's a full pattern of disregarding social norms and others' rights. At first, they might charm you, but underneath, there's often exploitation and hurt. ASPD is tough to treat because many with it don't see a problem. But therapies, especially cognitive behavioral, can help manage behaviors if they're willing. Medications sometimes help with aggression or mood, but there's no specific drug for ASPD. Histrionic personality disorder, HPD. Everyone loves the person who's the life of the party, enthusiastic and dramatic. That's a HPD, but with a twist. People with HPD are excessively emotional and crave attention constantly. Their moods change fast, and they often use their appearance or flirtation to get noticed. It's not fake, it's a deep need for approval. Therapy helps by increasing emotional awareness and healthy ways to connect beyond the spotlight. Avoidant personality disorder, AVPD. Ever want closeness but feel frozen by fear that people will judge or reject you? That's AVPD in action. It's social anxiety cranked up, a severe fear that keeps you avoiding relationships or trying new things, even when you want to. The bright side? Therapy helps you build confidence and safety in social spaces. That overwhelming loneliness can give way to real connection. Dependent personality disorder, DPD. Know someone who can't make a decision without asking others? Who feels lost or helpless alone? That's DPD. This disorder is about overwhelming need for care and support, so you cling desperately and fear separation. Therapy focuses on building independence, decision-making skills, and confidence, helping you go from scared alone to strong alone. Narcolepsy. Uncontrollable daytime sleep attacks. Suddenly, mid-conversation or walking down the street, your body just can't keep your eyes open, and you slip into deep sleep. That's narcolepsy. It scrambles your brain's sleep-wake cycle, sending you into unexpected sleep episodes day or night. You might also experience cataplexy, where strong feelings cause sudden muscle weakness. No cure yet, but treatments like stimulants keep you alert. Antidepressants help with cataplexy, and scheduled naps plus routines make a big difference. Sleep apnea. When your breathing stops. During sleep, ever wake up choking or gasping? That's sleep apnea. Your airway narrows or gets blocked, breaking your sleep into fragments. Even if you don't remember those micro-wakes, they keep you from restful sleep, leading to fatigue, headaches, and serious heart risks over time. Treatments include CPAP machines, which gently blow air to keep airways open, plus lifestyle changes like weight loss or sleeping position tweaks. REM sleep behavior disorder, acting out dreams. Usually, your body is paralyzed in REM sleep, so you don't act your dreams out. But with REM sleep behavior disorder, that safety switch fails. That means talking, yelling, punching, or kicking while asleep, sometimes hurting yourself or others. Often connected to neurological issues, treatment usually involves medications like clonazepam and creating a safe sleep setup. Sleepwalking, moving around while asleep. Sleepwalking might mean getting up and wandering around without being aware of it, often with no memory afterward. Common in kids, but adults get it too, especially under stress or sickness. Though usually harmless, sleepwalking can cause injury. Good sleep habits and therapy help manage it. Meds are rarely needed. Night terrors, waking up, terrified without a dream. Night terrors aren't nightmares. They happen in deep sleep, making you scream, sweat, or thrash. But you usually don't remember episodes. Mostly in kids, night terrors often fade with time. Preventing sleep deprivation and reducing stress helps. If intense, a sleep specialist can guide you. Nonverbal learning disorder, NVLD. Imagine being really sharp with words, vocab, and reading, but totally lost when it comes to understanding maps, charts, or even social cues from people's body language and tone. That's what nonverbal learning disorder feels like. If you have NVLD, you likely have average to advanced verbal skills, but struggle with nonverbal stuff like visual spatial tasks, putting together puzzles, reading maps. Fine motor coordination, tying shoelaces, buttoning shirts, math reasoning, and visuospatial memory. Understanding social cues like interpreting facial expressions or tone of voice. In school, you might be the kid who excels at spelling and memorizing facts but hates coloring or using scissors. Your brain separates words from images in a way that gets confusing. As a kid, this might look like paying attention but not quite getting what others mean with expressions or body language. Auditory processing disorder, APD. So you can hear the sounds all right, but somehow understanding what those sounds mean is a massive challenge. That's APD. If you or your child have APD, noisy places feel overwhelming. You might hear voices but miss keywords, confuse similar sounds, or struggle to follow spoken instructions, especially long or complex ones. Some common signs: asking people to repeat themselves a lot, difficulty understanding speech in noisy rooms like classrooms or restaurants, poor memory for things you've heard, difficulty following multi-step directions. APD often overlaps with ADHD or language disorders, making diagnosis tricky. Helping hands include auditory training exercises that improve your brain's ability to distinguish sounds, special listening devices that reduce background noise and focus on the speaker, environmental changes like sitting closer to the teacher or using written instructions. Speech therapy can build better listening and language skills. The goal? Help your brain catch up so you don't miss out on conversations and learning. Language disorder, when words don't come easy. Having a language disorder means struggling to understand or use spoken language. This might look like trouble forming sentences, finding the right words, or comprehending instructions. If you find yourself using simpler phrases than your peers, or often misunderstood because your sentences sound jumbled, this could be why. Sometimes kids with language disorder talk later or speak unclearly. Therapy from speech-language pathologists helps a ton. They work with you to grow your speaking, listening, and comprehension skills through tailored exercises and practice. Thanks for sticking with this mental health deep dive. Whether you're navigating your own feelings or seeking to understand someone else, remember, mental disorders don't define you. With the right care and support, recovery isn't just possible, it's waiting. And if you want more deep dives, hit the bell so you never miss out.